Hello, this is Luis. Welcome to the HDTV updates from the ESC 2022. Today we bring you the Day 3 updates of ESC 2022. Mora presented the results of patient-level pooled analysis of DECLARE-TIMI 58 and DAPA-CKD trials and reported that dapagliflozin reduced CVD, hospitalization for heart failure, and kidney events consistently across a wide spectrum of kidney function, but with apparent greater absolute risk reduction among patients with abnormal kidney function. Alexander presented the findings of the Pacific AMI study, the first randomized placebo-controlled trial of asundexian, a small molecule factor 11A inhibitor, in patients with an acute myocardial infarction. Asundexian 50 mg daily inhibited factor 11A activity nearly completely or higher than 90%. Lopez highlighted the INVICTUS trial findings, which showed that when compared to Rivaroxban, VKAs improved cardiovascular outcomes and mortality without increasing the risk of significant bleeding in patients with rheumatic heart disease (AF). Doherty presented the results of the DAPA-HF study in relation to endothelin-1 tertile and reported that higher serum endothelin-1 concentrations were associated with worse heart and kidney clinical outcomes, independently of other prognostic variables including NT-proBNP and troponin T. Petrie presented a session on which drug when, how to sequence heart failure drugs in 2022, concluded the conventional sequencing is inefficient, time-consuming, and did not allow patients to benefit from early event reductions from all HF medications. He further emphasized that more rapid and non-conventional HFrEF sequences are related with greater reductions in mortality and HF hospitalizations. Sharma presented the final results of the AXIOMATIC-SSP dose-finding randomized trial, which found no dose response for the primary composite endpoint of symptomatic ischemic stroke plus covert brain infarction. Furthermore, at all dosages except 200 mg BID, milvexian was related with fewer symptomatic ischemic strokes. Andres reported the results of a systematic review and meta-analysis on oral anticoagulants in patients with AF and stage 4 and 5 renal disease, concluding that the use of DOAC when compared to warfarin did not substantially lower the risk of thromboembolic events. Major bleeding followed a similar pattern, with a non-statistically significant tendency toward reduction in the DOAC group, particularly with apixaban. This concludes our coverage of the HDTV updates for Day 3 of the ESC 2022. We'll meet again tomorrow. Have a good day.